Good evening, doctors. I'm coming straight from the Vistara flight from Coimbatore, which was delayed by 3 hours. I thought I wouldn't be able to make it, but I think Vistara had its own plans to make it happen. So I'm actually delayed only by a few minutes. According to the schedule, it was 8:10 or something. So I'm only delayed. But the flight, because of the bad weather, raining here, the flight took off late. And then I would have had actually 2 hours before to even listen here before me. But thank you for giving me this opportunity, Economic Times, in The Edge, for bringing me back to a profession, bringing to individuals who I owe so much. We all owe so much to the medical profession, but I owe you something very, very special. I must tell you that. I wouldn't have been here today at this age had my father not been saved when I was only 6 years old. He had suffered a huge, almost nearly a fatal accident when I was only 6 years, and his nearest doctor friend called Dr. Mohan Singh, I remember, how he asked for in Vijay Hospital, Namritsar, saying, "Agar Dr. Mohan Singh aa gaya, to main bach jaunga, nahi to nahi bachunga." And that's a fact that Dr. Mohan Singh, when he came, he handed himself. He had a very fatal accident, not fatal accident, very heavy accident. He was hit by a jeep on a Sunday when he was on a motorbike, and then left him abandoned on the road. And then the people picked him up and sent him to Vijay Hospital. I remember that day as a 6-year-old when my mother was running without chappals on the road, and we daughters followed Mummy, saying, "Mummy, kahan ja rahe ho? Kidhar ja rahe ho?" Mummy had no energy to tell us. So friends, I want to tell you, whenever I do get an invitation from the medical profession like this, I have always honored it, because I owe so much to each one of you. I wouldn't have been here today, because had my father not been there beyond my age of 6, and we were 3 daughters, what Mummy had at that time, 3 girls, imagine, and Mummy wasn't working, she was homemaker, what would have happened? You wouldn't have had me as the first woman of the Indian Police Service. You would have had somebody else, but not me. So I owe this to your profession. I wanted to be a doctor when I was growing up, but I wasn't as bright as you were. I was more of a tennis player than a student of difficult subjects like yours. So I do know how much toughness of studies you've done to reach here. I have done some little thinking about what you asked me to speak, and I'm going to speak up. It's more of the administrative. It's my role is, which have you been asked, is engaging communities in the decision-making process, makes people accept health mandates of the government wholeheartedly, and reduces reluctance levels while improving health indicators, which is improving healthcare facilities in the hinterlands, reducing friction points between administrative officials and local people, improving trust in the system. Perhaps from my administrative background of last 5 years when I got an opportunity to serve Puducherry, and also do 2 years as the administrator there to handle COVID the last 2 years, I would share that experience with you. Not theoretical, but my practical experience, which I directly encountered as the administrator there. What was not right, and what could have been right, and what we did set right, but what we can do in anticipation of all disasters which we can have any time now, the kind of climate change which we are having. There'll be disasters coming our way, and medical facility would be absolutely urgently required in a very, very comprehensive, coordinated manner. So here's my experience of what I think we ought to be ready for. Number one, in answering to this administration better, how do we increase trust, etc. Here are my points, which I worked on over the flight, the last few hours I was. Number one, what I would like to say openly, first, right away, is this: that while India has the largest number of medical colleges, and Puducherry had 7, such a small territory had 7 medical colleges. So while India has the largest number of medical colleges in the world, nearly 90,000 MBBS graduates pass out every year. from 595 medical colleges of allopathy, besides 53,000 graduates in another 733 Ayush medical colleges pass out every year. Apart from increasing availability of accessibility of doctors or medical professionals in rural areas, the idea behind the program is, which I picked up, which I saved in my library, was where on 16th of February, the Times of India reported this news item saying NMC may make family adoption program part of MBBS training. This is a news clipping which I had in my medical file, which since it interested me, I'd kept it. And it said this. This is where it's saying that apart from increasing availability and accessibility of doctors or medical professionals in rural areas, the idea behind the program is also to provide students with on-ground, hands-on experience from the beginning. It has been based on a study conducted by Vanikar and Vijendra Kumar, member of UG Medical Education Board, where it said that each student may have to monitor 5 homes as a draft plan. I do not know, this news item was of February 22. I do not know whether the plan is already in action or not, but if it isn't, it may, because if the NMC is concerned with it, as engaged in it, maybe you'll get an announcement. So based on these news items and other things which I see as developments, here are my following points, which I've found that had we had this practice in this country before COVID as a peacetime project, we would not have suffered in COVID as much as we did, both in the first and the second lap. Number one, medical colleges, to my mind, should be mandated. Medical college students and medical college should mandate all its students to become part of some village, some locality, and attach them with dispensaries, etc., from year one. Now, this is my experience from these 7 medical colleges I saw in Puducherry. I saw a lot of silo functioning. Each medical college was very silo. Every nursing home, school was very silo. The technical were they would not come together. They wouldn't shake hands together and work together at all. So I saw it with my own, and when I do remember when I made an effort to bring these 7 colleges together, since they were all private trustees, they were all very wary of each other, and they were not willing to come together as a pool of students who could go to the streets, go to the dispensaries, and do the following things. But I think if it's mandated, after all, you have a person who's medically inclined. So what is the problem in attaching them with dispensaries or in their own village or in the resident or in the localities from year one? They're not going to dispense, they're not doing surgeries, they're not injecting, they're doing nothing. They just be attached. They can help the doctors in any way. So that means they're seeing and they are listening. At least a seeing and a listening of the processes begin, and they can start doing data entry. At least they are all coming into computers. So they can do data entry of medicines dispensed, etc. So once they start seeing and listening, it will start orienting them. My number 2 is, they should not have a Sunday. It's not saying आज संडे है तो दफ्तर बंद. डॉक्टर का संडे कभी बंद नहीं होता है. गायनोकोलॉजी का सवाल ही नहीं उठता. सो इसलिए कोई संडे नहीं. आपको वीकली चाहिए, एक दिन वो मिलेगा जो दे सकते हैं, देंगे एक दिन ऑफ. लेकिन संडे का कोई राइट नहीं, सैटरडे का कोई राइट नहीं, छुट्टी का कोई राइट नहीं. वी नीड टू गेट दिस आउट ऑफ देयर हेड्स. इट्स लाइक अ पुलिस ऑफिसर. Police officers also should be trained, and we are trained that there's no Sunday or Monday or Diwali or Dussehra. In fact, on that day, you have more work. So I think that orientation should begin early. Number 1, these are my following checklist of ideas. Is medical colleges mandated from first year also already? Students, okay, you have your village close by, you adopt. You have your locality, adopt. You have an RW, adopt. But go into the field on a regular basis to see what you're listening. So villages attached with dispensaries, as I said. And even work in the mobiles, because sometimes there's a mobile dispensary, which I remember we had. So they sit in the mobile. They will start learning very fast a practicality of the theory which is being taught. And of course, no day off as a fixed day. It can be any day of the week. That means all 7 days, they are on emergency. They are accessible, and they can't say, aaj chutti ka din hai, or they get off the phone, so say, okay, I can take off and the patients can work. No. If you are in a policing profession, if you are in a fire brigade, if you're an emergency service of the kind of medical have, then you have to be available 7 days a week, phones. So I think that training must begin from day one. Similarly, bring feedback. Now, when they go into the field and dispensaries, second thing is they must bring a lot of feedback. What's happening? What are the people saying? What's the trend of the disease? Or what's happening in the community? So, feedback to colleges and to the academy, which means teachers. So feedback is very important. Every area has its own issues of its own concerns. Maybe water issues, which is causing the disease. Maybe cataract, which is hugely. Maybe diabetes spreading. We do not know. Every area has its own challenges. So bring a feedback and feed it into the data. So data feeding is important. They can easily do awareness campaigns. I remember when we wanted the students to go do awareness campaigns of mask lagao, sanitation rakho, social distancing rakho. At least they could do awareness campaigns, wearing the white coats, wearing the white student coat. But they weren't available. So what if these 90,000 plus are available for awareness campaign? Imagine, it took us a long time I'm on record to say this. It took us a long time to orient the students to say, look, this is also your role. Play your role as a community doctor. Do education camps. Do work on digitization. Educational campaigns can be on nutrition, on healthcare, on childcare. Then visits and hearings in regular forum. Secretary Health plays a very vital role. We've had Secretary Health who are brilliant. Some of them are doctors and yet not field-oriented. They were doctors but became the IS and became a bureaucrat. They were not field-oriented. When they should have been or they were not doctors, but they were bureaucrats and absolutely office sitting, whereas they could have moved from dispensary to dispensary, hospital to hospital, village to village, and seen things for themselves. They did not do it. I saw them not doing it. By the way, I'm not saying this for the first time. I've written this in my book. Recently, I released a book called Fearless Governance of my 5 years of work in Puducherry. And there's a chapter on COVID in that. How we handled COVID, how we suffered, and how we had to come. That's a story by itself. As the head of the administration, I had to send an SOS to the Prime Minister's office and to the ICMR on a tweet, because we were totally losing out. We were having people lying we had run out of beds, we had run out of PP kits, we had run out of medicines, and we did not have personnel, and doctors were crying hoarse. They were exhausted. And I start to wonder what will happen if we can't save the situation. And people had almost given up hope that we would be able to recover it all. And at that time in August of the year before, I sent an SOS Twitter to the Prime Minister that Puducherry urgently requires extra help. And Puducherry requires expertise because we are running out of. It's written in my book. It's in the book Fearless Governance on the COVID chapter. If you get to see this, it's available on Kindle. But some of you who want it, I can share my soft copy with you. I think my soft copy of the book is openly available even on my website. So anybody to read, go straight to the COVID chapter and read it. Or I can send you the COVID chapter only to read how we handled and turned around COVID. It was this crisis where, because the Secretariat had failed us. The Secretariat, and interestingly in that book you will see how even the Secretary went on leave. At the crisis time, he asked for leave and he just went away, saying due to tension. He did not say I have medical issues, he says due to tension. He got so much of tension that he just left the job and he went. So we were even getting headless as Secretary Health. And the Honorable Minister was very interesting there. He was only divide and rule. That Honorable Minister who finally lost his election by the time I'd left. He was only unions and the doctors' unions and putting one union against the other. This is a fact which I face. This is what is happening in many medical colleges where due to increments, positions, designations, status, head of the departments, they are into unions, and they were divided completely. So doctors divided, hospitals divided, secretary not available, so students not on the ground. These are the situation, not exclusive to a one city, one place. It could be possible all over. You are seeing me as an eyewitness account to tell you, but I do not know how many others will give you the eyewitness account. That's why the book title is Fearless Governance, because it's fearlessly written at what had gone wrong at that time and who was responsible. But I said that tweet went to the Prime Minister's office. It got responded immediately. And we had the team coming from the ICMR within 24 hours, and they were from the ICMR unit of Tamil Nadu, and they landed the next day, and things turned around. The statistics will prove in that, which I've proven, that by September end, we had stabilized, and by October, we had under control. Yet it took us 8 grueling weeks to bring things under crisis. The team they sent was not enough. We had to double the team. And what they did is also mentioned in the book. I think that's a good chapter for you to read, what the ICMR put, how did they put pillars for training and all the work which we needed to do, how did they manage and help Puducherry. So Secretary Health visiting regularly is and play the fulcrum or the pivot around which everybody comes together as a regular forum. Now this needs to be done in peacetime, because disasters are going to come and go. They will repeat, and you will always be called for. Or you will always be needed. Similarly, then networking, even of private sector. I remember private hospitals just played hostile. They shut down shop. Actually, some of the private hospitals, friends, clinic, they just shut down the shop. Or if somebody is going for COVID, they would not report to the government, would give him a crocine saying, "Bukhar hai thoda sa." And the man suffered. He died because he was COVID positive, and yet he was given a discipline others and got his own whatever reason. This was sad. The private sector doctors did not come online and get into network. So I'm talking about networking. Another thing, we took a lot of time in setting up control rooms. Wherever you are, seek out. I'm giving you ideas to seek, ideas to talk, ideas to demand, ideas to ask for. Is a control room. We took a long time to set up a control room. Again, it was because of negativity of political leadership when control room could not be set up. Every time I remember when we made an effort to set up, somebody came in the way, "Iski zarorat kya hai? Iski zarorat kya hai?" Till the prime ministers, all that intervention came from the top, and they came under searchlight. The control room got set. Fine. Another thing which I wanted to share is the nurses' role. My God, we had so many nursing centers. Nobody stepped in. We were short of nurses. And as it says, India is short of nurses. And here it is. I have the figures where the nurses are in short supply. And here it is. Pandemic revealed lack of trained health personnel. Only one nurse for 670 people in India. WHO norm is 1:300. So when we were short of nurses even at that time, you had a nursing hostel. You had a technical hostel. Technicians. Technicians were in short supply. Why can't we network? Why can't the departments of health secretaries network during peacetime between the medical colleges, the nurses, the technicians, the radiologists, the diagnostics, the private hospital, and meet once in a month as a forum, which is essential. Then comes the trust factor. How do we increase? You've asked me to speak. How do we increase the trust factor? The trust factor is to work with panchayats. We must work with local area panchayats. We must work through Mahila Mandals and volunteers and people. In India, the good news is people still trust the government. Though the government performs sometimes and does not perform. It performed, that's why we could get out of COVID. It performed. Doctors performed, nurses. But when? When they could have performed much earlier. Much earlier. Yet, the people also will still go back to the government for help. That's a ratio which the recent surveys reveal. So people do trust. Therefore, we could continue, we work with panchayats, volunteers, the Mahila Mandals, the NGOs, the social organizations, having health camps. The Rotaries and others have health camps. Connect with them, this volunteerism, and they will have health camps with you time to time. So it's not necessary that we wait for another COVID. We must continue to do whatever we can individually. And many of you as medical practitioners, I know, do so much of volunteerism. You stretch out to the area, you go out and hold free camps. Some of you are Rotarians, Lions, whatever you are, the Lions on the eye issue. So we continue to hold. Then we have community radios. Why not use community radios wherever they are? Like Puducherry University had a community radio, but it was never using it for right kind of messaging. So doctors could know where are the community radios, which can be. Then the SMS alert systems. Similarly, constant alerts. Similarly, see, I was today traveling with somebody on my left who was in Chicago, a doctor, and I asked him that, and he was looking and he was appreciating our COVID response ultimately. And he said, India has been a very good situation, how well vaccination was accepted. How divided, the states of America were on vaccination. You know that. How individuals have erred saying, we will not do the vaccination, come what may. We've not had that situation. We had a mild opposition in the beginning. After that, everybody is ready. Nobody's opposing vaccination. He was appreciating India to say how well Indians have accepted the need for vaccination and the instructions time to time. Then similarly, the public-private entrepreneurship. It's time for more medical care, so private as startups, as houses, as business, as entrepreneurship. So more and more of public-private, this is you. I think most of you are from the private sector, is entrepreneurship. Innovation in research is very vital. Now, innovation research, to my mind, will come when we spread out these students. They should be also research-oriented. What's happening in the locality? Why is it happening? Why is diabetes increasing in a particular section? Why is cataract? What about disability issues? What about Down syndrome issues? This will not come. Maybe parents would not come. But if our students pick up adopted areas, we will know what's happening. And that's where our strategies of different hospitals, government hospitals, or government policies, or collectively could be formed. So innovation, research, and the diet. Most of all is the nutrition. He also told me, this gentleman who was traveling with me, he said that persons with diabetes, some of them do not know they have. But if they have, the diet which they're having, which is carbs, a lot of carbohydrates. I'm not a doctor. I'm only telling you what he's saying. He said, we are not looking at the diet which they're having. Is it carbohydrates? And in carbohydrates, is it accentuating and what is about the nutrition? So our students could be talking about nutrition. And what about yoga? What about yoga? What about meditation? What about mindfulness? So these are the things which our students could do over the years, spread the right kind of messages. The gentleman I'm referring to, fortunately, I have his name here. He's Mr. Narasimhan Ramakrishnan from Chicago. He was the one who was sitting next to me when I asked him this question. He was very appreciative of many things which we were doing, but felt that there's a need to do more. Now, finally, I would say, as somebody said, health does not always come from medicine, friends. Most of the time, it comes from peace of mind, peace in the heart, peace in the soul. It comes from laughter and love. I think you were having somebody who was making us laugh, right? Right? I was wanting to wait to hear him, but then he just went away and gave me the place again. But this is what health does not always come from medicine, but most of the time, it comes from peace of mind, peace in the soul. It comes from laughter and love. Last but not the least, what I have for you is this. While the digitization says, it says doctors in the last millennium are remembered for major discoveries and advances in science and technology. Doctors in the new millennium should be remembered for their leadership, their humanity, and for enabling people to achieve and maintain health. So what I've suggested to you, some of these steps, I think we need to work together. Friends, we don't wait for COVIDs, but we have to be anticipating various disasters time to time. And if the medical community comes together, and it's not difficult at all, it's not difficult. In fact, it's such a joy when we all work together, whether in the private or the government. And I would urge you, wherever you are, please do not hesitate raising your hand, asking for an initiative, asking for networking, asking for coming together so that we can save lives, very, very precious lives. Thank you once again for this opportunity.